Today is the first day of two-day procedure FUE for covering front and crown of the scalp. The way that we design the donor extraction is we start from the upper half and extract everything here, and then the second day procedure it and remove it from the bottom section. That helps us with the local because we localize the top area that numb everything on top. Below it, there is no pain at all from the previously extracted grafts. To switch to manual in this case, often at the beginning I tried different methods to see which one works better. So we're done with the motorized and now we're checking the manual method. So we keep changing the angles or depth of extraction to see which one is the optimal. That may take first like 15-20 minutes of the procedure, and that tells us exactly what's the anatomy of the hair in individual. As I remove them, my assistant will pull them out and show them to me, and I look at them on the microscope. Need to change the angle a little bit. Okay. Bottom, yeah, there was a key pressure thing there. I think motorized was a little better. To removing them with the motorized with a blunt punch. It's a sharp punch, manual punch, everything. This seems to be working the best. I'm going to go real fast. Pass of extraction, and we're gonna, after we're gonna set them up, we're gonna start placing the grafts, the remaining of the grafts. Honestly, we've been using manual punch for most of the procedure, which works pretty well. And we're almost done. With our first day of two-day FUE procedures, we took care of the front and corners with good dentistry. We come back tomorrow for first day one after his first procedure. We see him, we give him a hair wash, and then he comes back tomorrow, the day after tomorrow for second. We divide the 2 days back-to-back FUEs and decide not to do them for a variety of different reasons. In this case, we divided it because we didn't have any other option. So we had, those are the only days we had open. We didn't have 2 days back to back in the week that we wanted. Pictures directly from my camera. This is the front. You see nicely filled. Closely, you see those grafts in the front, the corners all the way back to here. The whole front is nice and solid. This is the corner. The other side, top angle, and obviously crown for next time. Like in 2 days, and we're going to take care of the crown and put another 1,500 grafts there. That's it for today. This is Dr. Mohebi from Mohebi Hair Restoration, wishing you a happy hair day. So this is the second day of 2-day procedure at FUE. We decided to increase the number of grafts for crown for 2,000. So we have a better coverage for the crown. The other day, 2 days ago, we did the front, all done, nice and dense. Now we're going to go over the crown. Now we're extracting the grafts. Extraction. Usually when we do 2 days back-to-back procedure, second day is easier because we don't have to do the testing and checking at the beginning of the day to figure out what method and what depth of punch we have to use. So everything is documented. We just look at the numbers, know exactly how to start. So every now and then we have to check to make sure the angle and direction of hair is still good. or if we need to adjust our depths or type of the incision we're making here. So today we have some training for our junior technicians. Every now and then we have to retrain our technicians for new techniques, to train our technicians with more efficient ways of doing things. So today we have Patty and Marcus. And Marcus have volunteered to become our patient models today, so we can make some sites and place some grafts. It's important to know how to design a hairline for a woman and for a man, which are different.
What are we starting with?
Probably we can start with Marcus. Of course, Marcus doesn't have a chin. So Marcus has a chin. So what we do for hairline, we want to say a proportional face. Face is a good-looking face. So distance between chin and tip of the nose should be the same as eyebrow to hairline. So your hairline, we design it. So let's assume his distance is like 7 centimeter here, tip of the nose, the distance between the two eyebrows, and a hypothetical hairline because human hair is not exactly like Marcus' head. So I'm going to design the hairline. So just designing the hairline. This is the temporal point. This is the receding corners. And we're done with the second day of our 2-day FUE hair transplant from donor area of the back to the front. And look at the picture of today and see how he looked before he left. This is the area that we covered today. The entire crown area was dense. We put more density in the whorl area and we spread around, and we also put some in the front. And this is how the back of the head looked. Everything was covered, even below that area was transplanted, so it's going to have a reasonable coverage of the crown and top. This is Dr. Parsa Mohebi from Parsa Mohebi Hair Restoration, wishing you a happy hair day and a great week.